Okay, so for today's deep dive, we are heading into the operating room of the near future. We're looking at surgical robotics, specifically between 2025 and 2028. And the sources are really clear on this. The big pivot isn't just about better machines. It's a total shift from minimally invasive surgery to these intelligent, data-driven surgical ecosystems.
That's it, exactly. I
Yeah.
mean, the competition between the big three, so that's Intuitive Surgical, Stryker, and Medtronic, it's not about who has the steadiest metal arm anymore. It's all about who has the most computational power, the best sensors, the whole digital backbone of the system. The robot is becoming, a partner.
So let's talk about the hardware for a second. The new Da Vinci 5. The sources say it has 10,000 times the computing power of the last one. I mean, that just sounds like overkill, doesn't it?
It does, but you need it for the real-time AI. That huge jump in power is what allows for what we call edge computing.
So processing everything locally.
Exactly. It's all done right there in the OR. If you send that data to the cloud and back, even a few milliseconds of delay is just an unacceptable risk in a critical procedure. So that power is all about real-time safety.
And that speed directly connects to what the robot can feel, right?
Uh-huh.
I mean, the biggest complaint for years with robotic surgery was that surgeons lost their sense of touch.
That was the limitation. But it's really being overcome now. The Da Vinci 5 has this force feedback tech that's measuring forces thousands of times a second.
That's like a haptic renaissance.
It really is. And the data from the clinic is powerful. Studies show that this kind of sensing can reduce the force on tissue by up to 43%.
Wow, 43%.
Think about that. That's a huge reduction in tissue trauma. It means patients recover faster. It's a game changer.
And it's not just pressure, is it? I saw some emerging tech that's even using things like thermal haptics to show temperature differences.
Yeah, so a surgeon could literally feel inflammation or blood flow issues. But it gets even crazier when you connect all this data to what the surgeon is seeing.
You're talking about augmented reality.
Exactly. The sources call it intelligent light. It's about making invisible data visible.
Like the Active Sight module from Active Surgical. They use this laser imaging LSCI, I think, to put a real-time heat map of blood flow right over the video feed.
And that's not just a neat trick, it's incredibly powerful. In the trials, surgeons with that data actually changed their surgical plan in almost 18% of cases.
So in nearly 1 out of 5 surgeries, they saw something they couldn't have seen with their own eyes that made them change course.
Right. That's a massive potential drop in complications, which of course brings us to the next logical step.
Autonomy.
Autonomy. We're moving past level 1, which is just, basic assistance like a camera following the instruments. By 2028, we'll see level 2 become commercially available.
And level 2 is task autonomy. So the robot does a specific job on its own, like suturing, but still under supervision.
Correct. But the moment the robot goes from just assisting to actually doing something on its own, you run headfirst into a massive legal question.
Liability.
Yes. So the critical point is this. If an autonomous arm messes up because of a software bug, something the surgeon couldn't possibly have known about, who's at fault?
The surgeon or the company that made the robot?
And the way regulators are leaning now is to shift that liability away from the physician from malpractice and toward the manufacturer under product liability.
I mean, how could a surgeon possibly be expected to understand every single algorithm update?
They can't. And that's the point. It almost forces the manufacturers to ensure there's always a human in the loop with the final say.
So wrapping this up, what does this all mean for you?
Well, the big takeaway is that the quality of a surgery will depend less on the individual skill of one surgeon's hands.
And more on the collective intelligence of the entire system that's assisting them. It's almost a democratization of surgical skill, in a way.
Which leads to a final, pretty provocative thought. The business model for this is shifting to subscriptions. SaaS models for these AI safety modules. And there's the catch. So here's the question we need to ask. What happens to equitable access when the very best safety features, the ones that cut complications by almost 20%, are locked behind a really expensive recurring digital paywall? That's the challenge ahead.